I got to read up a little bit on your story about your background, how you got into this transition over to the kind of activism side of healthcare. But I was interested to hear a little bit more about kind of your experience in the nursing field. I have a lot of friends who are nurses, some who aren't nurses anymore, some who are still hanging in there. And I know that for you worked for many years as a nurse, but you, from what I was hearing about your story, from the very beginning, you kind of got like a really big kind of like welcome to how things are going to be for a lot of nurses in this industry.
Yeah, definitely. So I'll try to condense this story as best I can. But, I worked really hard in school. I wanted to work for the top hospital in my area. I had to go through many, many interviews with them because they really wanted the best of the best nurses. Finally got in. And then day one, I'm put on a different unit than what I was hired onto. And they kind of spun it in a way that I was like, this is this special program, you're doing a nurse residency program. And then in getting to talk with the other nurses, they just said, hey, turnover is too high here. There's no nurses on the floor that you're going to that are able to train you appropriately. Like they just don't have the time or the experience. So it's just like day one, I was like, red flag. And then from there on, it kept on happening. Like I kept on being put in unsafe situations. They kept on giving me quote unquote promotions where they're like, hey, be a charge nurse, start training new orientees, do this, do that, be on this committee. Those, it came with more work and no more pay, like they were just trying to stretch me as far as possible. But yet they appeal to both nurses and doctors or any healthcare worker. They appeal to your like altruistic personality. They're like, you got into this to help patients, right? Like you shouldn't care about money. You should just be trying to help as many patients as possible. But yet they never provided us with the resources that we really needed to help patients. So it was just like it's been coined as moral injury, right? Like you're trying your best to help in an environment where it's almost impossible to help, and it feels like every day you're in an uphill battle. So that's why nurses, doctors, healthcare workers get burned out so easily. And that's my story too. I got to this point where I had a very potentially dangerous situation happen at work where I was extremely close to unintentionally causing harm to a patient because I was so overworked and overwhelmed, and they had just pushed me past. I had too many patients, way more patients than I was supposed to have. There was just... I didn't have the tools to be able to take care of people well. And it seemed like every day they were giving me less and less to be able to do that. So at that point, I had decided, like I said, to go into case management and see, you want to see how the sausage gets made, right? You want to see how this is working, why this is happening, like why can't they retain staff? Why can't they pay us more? Where is this money really going, and why isn't it going to me, and why isn't it going to my patients? So once I got into that side of it, I just saw how these large hospital systems that were more like, corporations, and then of course these large insurance companies were just battling each other day in, day out, trying to see which one could get paid or save the most money. And it's just like healthcare workers and patients were collateral damage in that. Healthcare workers were just getting burnt out and used up to their maximum potential. And then of course patients are not getting the services they need. They're not getting the care that they need, and they can't even access care because they can't afford it or it's too scarce in their area. And I kind of just hit my breaking point with that. And I came home to my husband one day just bawling, and it was just like, I either need to change the system or get out of healthcare completely. And I know how wild of a statement that is, but I've got to at least try. And then once I fail at it, I'm going to go do something else because I'll be like, I don't like this anymore. Like it's too taxing on me, physically and emotionally. So, my husband was just like, all right, quit your job, go for it. And then if you want to do something else, we'll do something else. So I quit my job, I went for it, and then it started to succeed. And I was just like, oh crap, I got to do this now. Like this, I'm committed to this. I got to actually, give this my all because it's making a difference. Like I'm helping to educate patients. I've made just great connections with other people who are in this space, just so much farther ahead than what I am right now. And I feel hopeful, even though I know how bleak the situation is, as long as we can continue to educate patients and educate healthcare workers on what's going on and what they can do to combat it.
It's really hard, I think, sometimes to stay hopeful when you see really difficult circumstances and systems in place. But I think it's encouraging to hear that, even though I think you know more about all this than most of the people listening to this than me, and you've seen a lot more than we're all probably going to see. But even throughout that, you can still see some glimmer of hope that, we can make some changes and things can improve from where they are. So because it can be really hard to hold on to that given, so many other factors.
It is. And I learned pretty early on, because when I left my job, my mindset was like, okay, I'm going to change this system. And I learned pretty quickly that the system that we have in place is not going to be changed. The players who are running that system are too big, too powerful. So I think the only way we're going to kind of move the needle is if we start pointing out the good guys, like the entities who are playing fair, who are doing right by patients, and driving patients and healthcare workers towards those guys instead. So we might not be able to change the system that we have in place, but we could potentially drive patients and healthcare workers towards a new system. So that's what I'm trying to do now.